Let's talk about the challenges, because they are there. And I think it's important that we talk about those, particularly while we have a captive audience of legislators right here in front of us. So as we've looked closer, as the counties look closer at our criminal justice system, we saw that many individuals who are incarcerated for minor offenses, shoplifting, spitting on a bus, are caused or made worse by their chemical dependency or mental illness. And we found that their jail stays, how long they stay in our prison system, particularly for those with mental illness, were considerably longer than those without a mental illness. So let me give you a specific and very troubling statistic that will flesh this out. An individual who is booked into the county jail on a criminal charge or conviction will likely stay an average of about 20 days. A person booked into jail on the identical charge, but the one difference being that person has a mental illness, that person will likely stay for an average of 158 days. As much as 4 months longer. I have a lot of views on this, and I won't have time to share them all today. But just to put this, we'll just start with the number on this for taxpayers. For those who are in the psychiatric unit, which are a number, that's $300 a day for those folks. Many are homeless. Many lack the money for bail or await a competency hearing. There are many reasons why these folks are in jail for that extended period of time. There may be reasons, but that does not make it right. It is wrong. And we need to do something about it. I remember, and there's a newspaper article in the Seattle Times about this issue just last week, and our jail director gave a specific example of an individual who I believe was a shoplifting or a spitting on the bus, but a person who had a mental illness, and they were in our jail system for 45 days. It's not right. It's not right, and it's costing us as well. Many are cycling in and out of jail, emergency rooms, sobering centers, and other expensive crisis services because they are not getting enrolled and engaged into treatment services. We do what we can, but we don't have sufficient resources to meet this need. The bottom line, it's no surprise. People with these disorders are being locked up disproportionately, cut off from support systems, and their condition gets worse. It is wrong to use the jail as a holding facility for people who are mentally ill. And it's costing the taxpayers of King County millions of dollars each year. There is some good news, though, on this bad news front. Earlier this year, I introduced a motion supported by a majority of the King County Council calling for a detailed study and action plan to get people out of jail and connected to the treatment they need to reclaim their lives and stay out of jail. The motion calls upon the executive, the sheriff, the county prosecutor, the public defender, county courts to get together and develop a plan, one that includes treatment, case management services, and housing. That plan will explore the possibility of a sales tax increase of 0.1%. That's a penny on a $10 purchase, to put that in perspective, which will help fund mental health and substance abuse services and expand our therapeutic courts like drug court and mental health court. That's taxing authority, I should point out, that was authorized by the state legislature, I believe in 2005, that gives the counties the ability to increase that sales tax by that amount to use specifically for those services. In King County, that penny on every $10 purchase, what that would mean in King County is $45 to $50 million annually for these kinds of programs, significant dollars. So the county, the good news here is the county is moving quickly to examine the feasibility of such a measure here in King County. The plan is due, which I outlined earlier, in May, and the council will then decide how best to proceed. This is encouraging news. We're putting together this plan. Folks like Doug Stevenson and others here in the county in the areas I mentioned are working hard to develop this plan as quickly as possible and bring it before the King County Council so we can make the appropriate decision at that time. One more area on the challenge front that I want to mention before I conclude, and that is on state funding cuts. The county cannot take on the state's responsibilities for funding mental health and substance abuse. So let me give you one example of that. For years, we made up the difference in funding for Cedar Hills Addiction Treatment Facility to keep the doors open for that facility. Finally, with inadequate state funding and our own resources dwindling, we unfortunately had to close that facility. We appreciate last session, in the last legislative session, there was action that kept us from experiencing even more drastic cuts, and that was encouraging. However, over the years, we have had some difficulty with the state in having cuts to our funding, taking of our reserves, and that's money that included county dollars, and then reallocating those dollars to other parts of the state. King County contributes a significant portion, I believe it's about 40% of the state's total annual tax revenue. It is reasonable to expect that a fair share of those revenues will return to our community to serve our residents most in need. But King County only receives 25% of the state mental health funding. To put it another way, we have about 35% of the service hours here in King County, but receive again about 25% of the funding. So King County will continue to seek what we believe is a more equitable distribution formula, and we believe is simply an issue of fairness. To conclude, we are all partners: state and county government, clients and providers, advocates and family members. Mental health and substance abuse treatment works, and it is cost effective. Investing in mental health and substance abuse services saves money by reducing emergency services and criminal justice costs, while increasing public safety and opportunities for more independent and productive lives. Earlier this morning, I mentioned we actually had a briefing on this issue of this plan that we're going forward. We had an update from Doug on that. And I commented that the challenge is tremendous, and some of the statistics I mentioned are troubling with our criminal justice system. But one thing I've learned in my brief time as an elected official, which is much briefer than many of the folks who are here today, is that I'm often in a room where I'm arguing with someone else about whether or not there's a problem. Okay? In this situation, I think everybody agrees that there's a problem and that there's work to be done, and that is significant. I've really become convinced that half of what I do is just getting other folks to agree that there's a problem that needs to be solved. I think in this case, we agree that there's a problem, there are challenges, and we need to work together to solve those problems. So I'm here tonight to let you know the County Council stands ready to work with all of you and our governor in the next session on these very important issues. I really appreciate your time, appreciate all the effort you put in these very important issues, and look forward to working with all of you again soon. Thank you very much.